Hi, everybody.
Hello.
Nice to be here. My name is DrSelvaggio. I'm a retired dentist, and I'm here representing the District of Columbia Dental Society Foundation. The Dental Society Foundation is the educational and charitable arm of a dental society. And what we try to do is to educate, in this case, the public and healthcare workers on the importance of oral care for all of us. And I'd like to take a moment just to thank Home Care Partners for allowing us to record this, and to recognize Home Care Partners for many years of providing competent care and compassionate care for people, and for allowing us to be here. So thanks very much. I first got interested in this topic, in the topic of oral care for older folks, because of my practice. You know, I had a dental practice for over 35 years, and in that period of time, when I started, I was a young guy, and I had some patients who were in there maybe in their 40s or their 50s and 60s. So over the course of the 35 years, those people got older. Of course, I didn't get older, but no, I did. They got older, and for the most part, they were able to maintain their health, their oral health. But then I saw something happen which you see every day in your work, and that is, as people lose their ability to take care of themselves, they have to depend on others to take care of themselves, and sometimes it doesn't happen. And I realized it didn't happen after talking to aides who came into the office helping them out, was that they were never trained how to do this. You know, you guys are trained in what to look for when someone isn't healthy, how to take some vital signs maybe. You know, you are skilled people, but you never received oral care training, and hopefully I will show you why that's so important. And the other thing I noticed was that their children, who usually brought them in with the aides, didn't want much to do about helping them with their oral care because they felt a little nervous about mouths and stuff. So what I want to do today is to educate you on what you should know, show you some slides of what healthy mouths are, what not healthy mouths are, so that, you know, I'm not trying to make everybody become a dentist, but what I'd like you to do is to be able to recognize health from non-health and give you some tips on how to do things. So home care, we need you. Why do we need you? Well, we need you because our population is growing older. And that's one of the fastest growing segments of our population. And we just need more people to take care of us when we are no longer able to take care of ourselves. The other reason we need you is those people right there. You know, and I'm sure you're experiencing this, particularly you have been in the field for many years. You get to know these people, your clients, better sometimes than their own children know them, or at least in a different way. You get to see them in a variety of circumstances that their children don't see them in. And the other thing is you get to see them maybe more than even the other healthcare providers do, like nurses or doctors. So one of your functions is to be the eyes for others. And I put up the slide of lifeguards here, because when you think about it, lifeguards are trained to, first of all, they're trained to know what to do, and then they're the eyes for looking out for people. So you have to be the eyes for their family members, right? Because you might see something and you should be reporting that or informing their children about what's going on, or their other loved ones. And also, you are on the front lines. You have to let the other healthcare providers, maybe the nurses or the other doctors, because you're there, like, you know, almost every day, or you're there, you know, very frequently, and they're not. So you are the one who's able to see what needs to be done. So first, a little philosophy, and this says old people are sick because they are sick, not because they're old. And the reason I'm showing this is that, you know, when I went to dental school many years ago, it was kind of thought, well, you know, they're going to lose their teeth because they're old, or they're going to get sick because they're old. Now we know that with medicines and other interventions, people can live a lot longer and live healthier. So in terms of their oral care, we shouldn't think of somebody losing their teeth because they're old. It's because there's something wrong with them. And I'd like to show you what some of those possibilities are. You know, I could stand up here and give you maybe a 15-minute lecture and show you this is the way you should be helping people brush their teeth. But what I'd like to do is to educate you and give you some biology. I know I'm more interested in something if I know the why is something happening. So I want to give you some biology so you understand why when someone goes into being not healthy in their mouth, why that happens. So this is how we see the world. We see the world in big form. You know, we see people, we see buildings, but there's a whole other world we can't see, and that's the world of microbes, you know, small things. So, you know, actually, you know, the world is covered in microbes. You know, we can't see them, and actually we need these microbes. But there, of course, there are some good bacteria and viruses and some bad bacteria and viruses. And so what I'd like to show you is that it's the small things, and when I'm showing you some slides, it's the small things that can make someone go from being healthy to not being healthy. For the most part, all the bacteria in our bodies are in our digestive system. It should be in our and we need them there because they help us to digest our food and absorb vitamins. We also have it all over our skin and in our mouth and every place. And so, for instance, in your mouth, you have good bacteria because something is going to live in your mouth because there's food in there and there are all sorts of nutrients in there. But the bacteria that we have in our mouths are healthy bacteria that belong there. So how do we get good bacteria? We get from our mothers. You know, when you're in your mother's womb, when babies are in their mother's womb, there aren't really any bacteria in there. But we need to get this stuff when we're born. So how do we get it? Well, just through the birth process, going through the birth canal, we pick up good bacteria from our mothers. And then when your mother looks at you and puts her finger in your mouth and you're getting the kind of bacteria you should be getting, we pick it up from our environment. The other gift your mother gives you is that for the last 3 months of the pregnancy, there's a surge of antibodies that is given through the baby through a placenta, and these antibodies give you what's called passive immunity. So you're coming out, because the world is a dangerous place, you're coming out to the world already with some antibodies provided by your mother and the good bacteria. So so the world is trying to get in, and our bodies have developed ways of keeping us from getting sick. Most important is really actually our skin. Intact skin keeps, you know what happens when you get a cut or something like that. It keeps you from getting infected. But also, bacteria can get in our mouths, can get in our ears. Our eyes have things and to keep you from getting an eye infection just from the tears, you know. So we have natural defenses. So, for instance, what happens when something breaks these defenses? So let's say you cut your finger. So what happens when you cut your finger? What do you see? It gets red, bleeding. It gets kind of puffy, right? Because that's your body's, it starts inflammation. So just something as little as a cut finger can start you to get an infection in your mouth, right? Excuse me, in your finger. So what about this? This is the most dangerous animal on earth, is a mosquito. And why? Because a mosquito is sucking blood, and the blood is used by these are all female mosquitoes that take your blood. They use to nurture the eggs, the proteins in the blood nurture the eggs. So the reason I'm showing you this is to show you that something just as small as a mosquito can cause malaria, and malaria kills about 500,000 people a year, you know? So, right, so something as small as a little mosquito bite, you know, can get you. So this is a very important slide. And the reason I'm showing you this is to show you how people get mouth infections. So of course, this is a tooth over here. And I want to draw your attention to this side of the picture here. So this is a gum that's tight against the tooth. Okay, so that's part of the natural barrier, like skin, you know. So for instance, I can't put my whole hand down my collar here because it's kind of tight around me. Well, this is an actual connection of your gum to your tooth. So in a healthy mouth, someone who takes care of their mouth and is able to take care of their mouth, the good bacteria are living on the teeth, and it's a disease state. Now let's say someone is not able to take care of their mouth. They can't brush their teeth, there's food on there all the time. I'll draw your attention to this side over here. So what happens is this is a show like this bad bacteria, plaque that's on there. So what happens is the gum starts separating from the tooth. So now instead of having this tight area where the gum is attached, you now have a loose floppy area. And now the bacteria, the bad bacteria, can get down into your body. So now, just like when you had a cut finger and it gets hot and swollen and red, your gum over here is hot and swollen and red. And just like with the mosquito bite, where you get an infection that goes into your general body that can hurt you, the bacteria can get into your circulatory system and can infect you. What can happen if this? So you can get certainly an infected mouth, but did you know that it can infect the rest of your body? So believe it or not, it is a contributing factor in diabetes, in heart disease, cardiovascular disease, Alzheimer's, rheumatic diseases such as joint diseases, and respiratory diseases. So you wouldn't think that somebody having a not healthy mouth could do that, but I'll show you how that works. So with diabetes, of course with diabetes you have trouble controlling your sugar. And when there's trouble controlling your sugar, it changes the content of your saliva, it makes it more sugary, and it makes this food for bacteria to live on. Also, it causes inflammation products. And for people who have diabetes, sometimes they'll lose their toes or their feet and stuff because of circulatory problems. So having a bad mouth can cause diabetes to get worse. And I'm showing you this slide here because I'm going to be showing you some slides of unhealthy mouths. It's a little bit, maybe a little disturbing, but I'm going to tell you that this is something I saw every day in my practice, and this is something every dentist sees every day in their practice when an older person or anybody who can't take care of their mouth or is neglecting their mouth comes in. And what's happening here is that the gums are swollen, they're red, there's food on there. And if you take the time to look in your client's mouth, I suspect that some of you, might be seeing that. So how does it affect your heart? So what happens is that I showed you that image of the bacteria getting down into the body from the gum. What happens, it goes into your circulatory system. This is what this is over here, it's pipeline, and it goes to your heart. And you've heard of, of course you've heard of heart attacks and hardening of the arteries and atherosclerosis. The inflammatory products and the actual bacteria can get in there and go against the vessels of the heart and cause it to be rough, and then it builds up not dental plaque but heart plaque, and then you get a blocked artery, and that's how people can get heart attack. And it can cause strokes, and it's a contributing factor to Alzheimer's disease. And I'm sure many of you are treating patients who have some kind of Alzheimer's or cognitive problems. Well, again, most people don't know this, but the inflammatory products and the bacteria, they've actually found bacteria in brain or products from that, and that can contribute, it's been shown to contribute to the formation of products in your brain that can lead to Alzheimer's disease. And this is a tooth over here with bacteria, gets into your bloodstream, and it causes your body to have a reaction against the bacteria, which causes bad antibodies to form, and it could actually make you have inflamed joints. So people who have inflamed mouths can get inflamed joints. And finally, lung disease. So you might say, how can you get lung disease? So this is again, sorry if this bothers you a little bit, but this is something that you will be seeing if you look in people's mouth. This is somebody who has not have the ability to take care of their mouth. So now, instead of having the healthy bacteria that you get from your mother and from the world, you now have a condition known as dysbiosis, that is unhealthy bacteria. These are really nasty germs that are in your mouth, and what can happen is that when you're breathing right now, you're breathing in bacteria, and your lungs have the ability to get rid of it because they have something called cilia, like little things that kind of get products and things out of your lungs, also contaminants. By the way, if you're a smoker, these little cilia get kind of paralyzed, and that's one of the reasons people get lung disease. But what happens is that now if you're breathing in these dysbiotic, these pathogenic bacteria, these get into your lungs. And you may have heard something called aspiration pneumonia. It's pneumonia. As you know, that's a big problem with older folks in nursing homes or in home care situations. So aspiration pneumonia is when something gets into the lung that doesn't belong there and causes an infection. And in this case, what's going on is that sometimes even pieces of food or certainly pathogenic bacteria get in there and can cause lung disease. So I'm just showing, this is kind of interesting, because when you're breathing, air goes into your trachea, into your lungs. When you swallow, food doesn't go into your lungs. So how does that work? Well, when you swallow, there's a little kind of trap door. So here's where food and air gets in, and it can either go into your trachea, your windpipe, or it can go into your esophagus that goes to your stomach. So when you swallow, your throat goes up, and a little thing called an epiglottis covers the windpipe so that the food goes down into the esophagus. So that's how, during this aspiration pneumonia, that's how that works. And the reason I'm showing you that is because I'll show you later that when you have a dry mouth, it's hard to swallow, and it makes this condition even worse. So what should we know as we get older? What affects our mouths as we get older? Well, as I already showed you, if people are no longer able to take care of their own mouths, then it's possible they'll get this situation where they have infected mouths. So that can happen. But other things happen to us as we get older. One is that our immune systems get older. Now we have lived for the last couple of years through COVID, and you saw how terrible that was. And it was particularly terrible for older people living in long-term care facilities and nursing homes. And there are several reasons for that, but probably the main reason is that their immune systems are not as healthy. I know with me, if I hurt myself or get sick, it takes me a little longer to get over it. Well, as you get older, that continues to happen. It just takes longer to get healthy. So our immune systems are not as healthy, and our ability to heal up from an infection or something. So that's one of the reasons why it's very important to keep people, and this is what you do every day, you're helping to keep people healthy and infection-free, because if they do get infected, it's going to have a worse consequence than if, say, you or I at a younger age get infected. So the other thing that happens when we get older is very often we're on multiple medications. And I'm sure you know that your clients are taking a lot of medications, and that's good, if they need to take them, because it helps to do things like reduce your blood pressure and control other, diabetes and stuff like that. But pretty much almost every medication has the ability to give you a dry mouth. And besides you may have clients who've said, I have a hard time swallowing pills, or my mouth is so dry. One of the reasons is that besides getting older, that tends to happen, is because medications can give us a dry mouth. And the implication of that is when you have a dry mouth, you can get a lot of cavities. So this is somebody who had a dry mouth, and if you see, the cavities are all kind of by the gum line. So I'm showing you this because, if you're looking at someone's mouth and you see something like this going on, you need to tell their children, you need to tell their nurse that, did you know that Mrs. Jones has this going on? I saw this, I went to a lecture, and now I kind of know what's going on. So what's happening here is that because the mouth is dry, the food isn't going off the teeth as it normally would with saliva, and it tends to collect by the gum line. And that's when food is not taken off the teeth, it tends to cause cavities. And also your saliva is very important, because your saliva keeps your teeth kind of slippery, and also it has antibodies in it and things that neutralize acids. So a dry mouth is a real problem. Also, it's a contributing factor towards aspiration pneumonia, because they have a hard time swallowing. The other thing that happens as folks get older, there's an increase in oral cancer. More people die from oral cancer than they do from certain types of skin cancers. So it's a real problem, and it happens in the older age group. And the reason I'm showing you this is that I'll show you some slides later. If you see something that's abnormal, you don't know what it is. It could be something just normal, that's an accident, or it could be a beginning of some kind of cancer. So, in order to know what's normal and not normal, you need to know what So this is a healthy mouth here. You can see the teeth look nice, cavities on them. The gums look kind of pink. Remember, I showed you those pictures before, all the food on the teeth and the swollen gums. So you don't see that here. And you may have clients who have. Do you have clients who have dentures? Some of them. Okay, and I'll show you about denture care. But yeah, so this is an upper arch. It's healthy. It's pink. There's nothing don't look irritations. The lower arch. The lower arch is a lot, this is the ridge here. The person's tongue is up here. By the way, lower dentures have a harder time staying in than upper dentures. And you may have clients who don't wear their dentures at all because they have a hard time. I'll talk about that a little bit. But one of the reasons on the lower is because the ridge is so skinny, it's hard for the denture to have a good grasp on there. So something that happens as we get older is we do get some bone loss. So you might see in your client's mouth that the gums, receding gums, okay? So that's, if you have an infected mouth, that happens more quickly, but it is kind of the normal process to get some receding gums. In this case, what you're looking at here, these are the teeth. Those aren't cavities, but the roots of the teeth are kind of darker colored than the top part that has the enamel on it. So if you look in someone's mouth, you see that it could be just the roots showing. Okay, so here's something that I think now you can say this is not, a healthy situation. So what's going on here? First of all, there's plaque and food on the teeth. Okay, the gums are swollen and red. So I'm going to tell you that when this person brushes their teeth, or when you brush their teeth, it's going to bleed. Okay, so let me take a step back and tell you, for you, if you're seeing any gum bleeding when you brush your teeth, that's a sign you have a problem. And you should not be seeing any kind of gum bleeding when you brush your teeth. For your clients, when they brush their teeth, there's going to be blood there. So if you see that when they're brushing their teeth, they have a problem. So what do you think this is over here?
Plaque.
Very good. Plaque or tartar, right? Yeah. So what happens? One of the reasons that we all need to go to the dental office and have our teeth cleaned professionally is that this is tartar or calculus, and it's hardened plaque. And when that gets on your teeth, you could brush from now till doomsday. It's not gonna. You have to usually a hygienist will do this. Will clean it off. So one of the reasons you and your clients and your family members need to go to the dentist is because this stuff gets on your teeth and has to be taken off. And if you were to take this off, underneath there's going to be bleeding and it's going to be red. So this is an unhealthy situation. What do you see? What do you see here? It's kind of swollen, right? Bleeding, right? What's gonna happen when they brush your teeth?
It's gonna bleed.
It's gonna bleed, right? Yeah. And again, I'm showing you this just to let you know this is something you should be. You're the eyes to be looking out for. How about what do you see here? Right, cavities, right. So on the healthy slide, you saw the teeth look nice. So over here, you see these dark spots, these are cavities. So if you see this, their children, your client's children may not be looking in their mouths, but if you see this, like when you're helping them eat or something, you need to bring this to the attention because this person needs to see a dentist, because cavities don't go away by themselves. They just get deeper, and then what happens, it gets into the nerve, you have a problem. So if treated early, it's much better. So this is a fungal infection. So this is what happens is that sometimes in older people, their immune system is not as good, and a fungus is something that can grow because their bacteria get off kilter. Or let's say someone takes antibiotics because they have an infection, and maybe you ladies might know about this. If you get antibiotics, you get a yeast infection, right? So fungus, yeast, the same thing. So again, I'm not showing you this because you're not dentists to be able to diagnose everything. But if your client is not eating because they say, my mouth is burning me, it's sore, well, you should ask them some questions, or why, or maybe even take a look, or certainly alert again their children or their other caretakers that there's a problem there. By the way, this is very treatable. Some antifungal medicines will clear that up. But if you notice your client not eating or complaining of a burning mouth, that could be it. So what do you see here? Plaque. What about this tooth? What do you notice here?
Shift.
Right. Okay. So you look in your client's mouth, and all of a sudden on Mrs. McGillicuddy, you see there's a tooth that's down that wasn't down. So maybe she fell down and hit her face, and now this tooth is broken up in the root, and it's kind of loose, okay? So what can happen from that is this is an x-ray of someone, this happens to have a crown on it, but someone who inhaled their tooth. So it's not in their stomach, it's in their lung, and that might need a lung operation. The reason I'm showing you this is that if you see something out of the ordinary that wasn't there before, instead of just thinking that, well, they're old and their tooth is shifting, it could be because the tooth is broken, and this is something that needs attention. Again, you're being the eyes for others. What do you see here?
What is that?
Swollen.
Yeah, it's a gum boil, right? Yeah. So again, if they're complaining, if it's swollen or in your mouth, if you get a swollen gum boil, what that usually means is that the tooth has died and it's causing an infection up there. And besides just being a local infection above the root, it can go into their bloodstream and cause problems. So again, I just wanted to get a little used to seeing things. So this is something on the lip. So I don't know what this is. Probably, maybe this person bit their lip, okay? And you may have heard of canker sores. You can get those on your lip. Some people just are really prone to getting canker sores, and they're kind of painful. They last maybe 10 days. They may have burned their lip. This is a little different from herpes, but also herpes can occur on the lip. By the way, you should always be wearing gloves if you're touching someone's mouth, because particularly something like herpes, you can get infected, and that can really be a problem. But I don't know what that is. It could be lip cancer, So, and you don't know what that is either. And if someone came into my office with this, I'd say, well, I think it's a canker sore, but try doing this to it. But if it's not gone in 2 weeks, please let me know, or please come back in 2 weeks. I want to see. So generally, if you see something that isn't going away in a couple of weeks, then you should let somebody know about that, because that means that there's a situation. So generally the mouth will heal up from a bite or something like that. The other thing you should know is that if your client goes to the dentist and has some dental work done, and they get numb, what happens? Your lip gets numb, you can't tell what it is. And if they eat, they could chew their lip. And I've had that happen with patients, unfortunately. So if your client comes back from the dental visit and their mouth is numb, just be careful what they're eating, eat some soft things, and ask them if their lip is still numb, because they could easily chew their lip, right? Yeah. Okay, so now I'd like to talk about some of the things you might see in your client's mouth. And you may know about some of these things and maybe not, but let's go through it. So dentures, yeah. So this is an upper denture that fits on that upper palate that I showed you earlier. And this is a lower denture, and it goes down. And again, you see this is like a thin ridge over here. So that's what they look like. Those are clean ones, and they should look like that. Then you might also see partial dentures. So this is someone who has some of their teeth, but they're missing other teeth. Have you seen anything like that, a partial denture? You may even have some. So this is something that the dentist makes. It goes in and out. This has to be taken out every day, as the dentures do, and be cleaned. We'll go over that. Some other things, sometimes these could be all plastic, they don't have to have metal on them. Then there's crowns and bridges. This is someone who is missing this tooth here. The dentist made this bridge that goes down on top of there. It should be permanent, and that is, it doesn't come in and out, unlike the removable partial dentures. So just to show you what some of the things are. And then there's implants. Anybody here have an implant? Good. So an implant is when this tooth was missing. So instead of having a bridge made, this is made of titanium, the same thing that's done when someone gets a hip implant, hip replacement. And then a tooth is, I'm simplifying this, screwed into there. So that's kind of a nice way of replacing teeth. And you may see advertisements for people who have all implant-supported dentures or crowns and bridges, that they're nice things, they are expensive. But you may see something in a client like this. So if you look in your client's mouth, you see two little kind of posts sticking out of there. This is an implant-supported denture. So remember I told you that sometimes those dentures are floppy and they don't stay in too well, particularly the bottom ones. Well, what can be done, and what some of your clients might have, are these two little implants put in there, and then this clips into there. So this is a little top piece that snaps into there, and that stays in quite well usually. So it's something you might see. So, okay. And so I used to see this. People come in and they didn't take their dentures out. They didn't take their dentures out because a couple of reasons. One is they didn't know they had to take their dentures out. I had a woman who was married, and her husband didn't know she wore dentures. Believe it or not, it's true. And I didn't tell him, but But you need to take your dentures out and take your clients out, and they need to be cleaned every day, because right over here, this is a whole bunch of adhesive that it was never removed. It's full of bacteria. Just in itself, this can cause an infection. So here's just some guidelines. So first, evaluate whether your patient is able to effectively self-care. So you should be encouraging, as you do, I'm sure, with have them take care of themselves, because they have to have a sense of, they have a sense of pride, and they want to know, I can take care of my own self. But you have to make sure that they're doing the right thing, and you can help them if not. We'll talk about tooth care in a little bit. So be observant for signs or problems. Remember I said, ill-fitting dentures, infections, loose teeth. You're the person who's there maybe more than other people in their lives. Have the appropriate tools, and I'll show you some of those things to take care. And monitor how they do it. If they're brushing their teeth, are they doing a good job? And maybe most importantly, communicate progress and problems to family members, because again, you're the ones who have to let them know this. So why do we brush our teeth? Well, we don't want to have bad breath. You get food off there. But the other thing is, I told you that there's good bacteria and bad bacteria. You are always going to have bacteria in your mouth, some kind of plaque in your mouth. As soon as you brush your teeth, some is still on there, and it's going to stay on there. But what you're doing is you're controlling the amount of bacteria on to keep it below a level. So the way I'd liken it is, let's say you don't take a shower for 3 weeks. What's going to happen? Well, first you're going to lose all your friends, right? But the other thing is you're going to get some skin rashes and stuff like that. And the reason is that it's normal to have bacteria on your skin, but if you don't take it off periodically, it's going to start, bad bacteria to start growing on there, and you're going to get a skin infection. Well, the same thing in your mouth. If you don't remove the extra bacteria that are there, you're going to have overgrowth. And I told you that term, dysbiosis. You're going to go from a healthy mouth with healthy bacteria to an unhealthy mouth with unhealthy bacteria. So how do you brush your teeth? First, let me say, from my practice, when I ask people how they brush their teeth, many people kind of knew it, but I suspect that most people brush their teeth by putting on the toothbrush and going, no, and spitting, right? And so the problem with that is that you need more time to brush your teeth, and you have to be methodical about it. Again, going back to taking a shower, if you go in the shower and you put some soap over here, some soap over there, and soap over there, but not the rest of your body, you're missing a lot of your body, right? Well, your mouth is a complicated place. Your teeth, they have all these little bumps in the teeth, so they have an inside and outside. So the way to make sure you do a good job is by doing it methodically, doing it according to a pattern. So this is one way of doing it here, which is quite good. And by the way, you should be using a soft toothbrush. A hard toothbrush is not such a good idea because it'll actually wear your teeth out. And you don't need a hard toothbrush to take off plaque. But you go back and forth across the person's mouth, across your mouth, and to the other side. And then you're doing the inside, and then do the bottom, back and forth. So by doing that, and it sounds easy, but if you actually take the time to do it, it's going to take certainly over a minute to do it. When you're doing it on your client, and we'll talk about it later, you have to use the same kind of pattern. And I hope that you do this, for your own mouth. So same thing goes for the bottom teeth. So here's Mr. Jones. He's great. He's pretty healthy. You go into his home. You're taking care of him. He's going to the bathroom and he's brushing his teeth. So what you should do is, instead of just saying, okay, Mr. Jones, it's time for you to brush your teeth, you should say, okay, Mr. Jones, it's time for you to brush your teeth. And as he's brushing his teeth, maybe kind of watch how he's brushing his teeth. And so I give you permission to blame it on me. You could say, I went to this lecture the other day, and this doctor told me that, you need to do it in a pattern, so I think maybe why don't you try this? So what you're doing is you're educating your client. And I think you probably do that all the time, don't you? Don't you show people how to do things, right? So this is just changing that same pattern of how to take care of someone's body, but applying it to their mouths. And then give them some positive reinforcement, like good job. So here's two other situations. So these people can't really get up and use the bathroom. So what is this over here called? It's a
Spit dust.
Mrs. Pan, right? Yeah. So what you're doing is but this guy, he's able to brush his teeth. You're watching him brush your teeth. You're wearing gloves, but so let him do it because he can do it.
Yeah.
So this woman over here has some cognitive problems, some dementia. She really can't brush her teeth, so you have to brush her teeth for her. And let me stop and say one thing: is that you all have a very difficult job, okay? And I think most people don't appreciate that because you're taking people who are vulnerable, they're at their most vulnerable, they're unhealthy. Sometimes they don't want you to help them, you know. But as professionals, you have to be creative and figure out a way to do what needs to be done. So we'll talk about that. So here's a case where this woman is not able, so this person, wearing gloves, is brushing the teeth for her, using that same technique. Don't use too much toothpaste. So here's another situation, is both these women are not able to brush their own teeth, but they might have some trouble keeping their mouths open, but there are things you can do. In this case, you know, you're brushing the teeth with one hand and you're using the back of another toothbrush to keep the teeth apart so you can get in there and do your job. And there's actually for sale, you can get them from drugstores or online. There are mouth props. So in this case, that's using to keep their mouth open so you can do what needs to be done. Okay, so let's talk about denture care. So I already told you that your dentures need to be taken out of your client's mouth and removed daily, every day. And what you should do is clean the denture over a sink with some water in it. The reason is that they're expensive, and if you're cleaning a denture and they're wet, you know, and they come out of your hand and they fall on the floor, and it's in the bathroom, it's a tile floor, you're going to break some teeth maybe, and that's pretty expensive. But if you fill, and we'll show you a picture, if you fill up a sink with a little water, do it over there. If it falls in the sink, it falls in the water, it won't break the teeth. I'll show you a special brush to use. You shouldn't use a regular toothbrush. Do not put dentures in bleach or mouthwash. So, you know, at night when someone takes out their teeth, usually it's at night, the dentures, it should be put in some liquid. Water is fine. Also, you can, if you want to get something Polydent or one of those products. But the reason to not put it in bleach, you might think, hey, this is going to kill, that'll actually mess up the plastic, and so will most mouthwashes. But they do need to be kept in moisture because if kept just outside next to the bed, let's say, they're going to get dry and then they'll get brittle. So this kind of, the plastic that's used for dentures needs to be kept moist. So you should be inspecting dentures for how they are, if they have any cracks. And also, if the person is talking and it's falling out of their mouths, you know, or they're complaining it's not working, then you should tell somebody that this person needs to see a dentist because your client is having trouble speaking and eating. Of course, don't attempt to do any adjustments yourself. So this is, what do you see here? Right, so this is, and I've seen people with a denture that's broken in half, but they put it in their mouth because they figure, well, it's still working. But this piece over here, that can cut their mouth, you know. So if you see that person has a broken or, you know, defective denture, you should let somebody know, even though they might say, hey, it's fine, because it isn't fine. So this is the kind of brush you should be using. Does anybody have this kind of brush? It's called a denture brush. So the difference between this and a regular brush is that, you know, a regular brush is used to brush your teeth. Your teeth are not made of plastic or porcelain. Your teeth are made of teeth. This is plastic or porcelain, and you can use something harder in order to scrub them with this. And what should you use? Soap and water is fine. You don't have to get anything special, okay? And here's someone wearing gloves, cleaning the denture over sink with some water in it. So in case it falls, they're covered. So let's talk about denture adhesives. Denture adhesives are fine. You know, sometimes, you know, the dentures get a little loose and they need a little help. So denture adhesive can help keep them in. Of course, if they're really loose, they really need to see a dentist and get them relined or remade. And by the way, existing dentures they don't have to be totally remade. Sometimes they could just have the insides changed to fit the mouth better. But they do need to be cleaned, the adhesive. So the way to use adhesive is You know, I've seen people get their denture and like just fill it up with denture adhesive and then put it in their mouth. And then now they think, well, that's going to fit really good. But what's going to happen is that it's going to go down their throat. It's going to irritate their stomach. So you don't need a whole lot of, all you need is like a few spots, like there, and there. And when that goes in the mouth and they bite into it for about 10, 15 seconds, it's going to spread out. And that can give a pretty good seal. Sometimes, do any of you ever have trouble getting dentures out of your clients' mouths? Yeah, sometimes I can say they're pretty good. Yeah, but they do need to be removed. Okay, so let's talking about changes in cognition or dementia. This is something you're dealing with all the time, and you know it's usually a continuum because someone will start out being fine, and then over some period of time, sometimes it's slow, sometimes it's rapid. They are not able to take care of themselves as they used to. Again, this is where you're the eyes, because you're there all the time, and you know that they used to be able to do this, and now they can't do that. So you have to let people know what you see. So here, in terms of oral care, here's some tips. One is that just provide short, simple instructions. Just as you do, like you wouldn't tell somebody who has some advanced dementia, okay, now put on your clothes. You'd say, okay, here's your shirt. Now we're going to button your shirt. We're going to, you break it into segments because their minds often can't contain a lot of complex information. So it's, okay, here's your toothbrush, we're putting toothpaste on it, we're putting it in your mouth. You're breaking it up into something that's easy to understand, and it won't confuse them. You could also use a watch me technique. You could say, see what I'm doing? And now you do it, So that'll remind them what can be done. And again, you should encourage them to do it themselves if possible, and you should monitor them as they're doing it to make sure they're doing the right job. Some other things to remember is avoid baby talk, but speak in a calm tone. So these are adults, they're not little children. So of course we should be respectful. And the other thing to consider is that, as we get older, we lose our ability to hear voices in a higher register. So if you are talking to them, okay, how are you doing? If you're in a high tone, thinking you're being kind of kind to them, they may not be able to hear you. So, speak in a normal or maybe even a lower register to tell them what they should be doing. Move slowly when approaching a patient's face. As I'm sure you're experiencing, sometimes people get a little paranoid or fearful when they get older. So you want to, move slowly towards them, especially their face, because their eyes, their mouth is there. It's a sensitive area. It's best to do oral hygiene after the last meal. So basically have them go to sleep if you're there with a healthy mouth. You can use a mirror to show them what to do. Approach the patient in front, at or below eye level. So instead of kind of looming over them, it's good if you could look at them in their eye on the same level. They'll feel more comfortable. And have all the materials you need ready there. And smile and be friendly. This is important. It's as basic as that seems. As people lose their ability to understand what's going on around them, they may not know who their son or daughter is. They may not remember you. But if one of the last things to go is their emotions, and if they see you smiling towards them, their body will say, this is a friend, this is not a threat to me. If the patient can self-care, monitor them. If you encounter resistance, you may need to do oral hygiene in a few sessions. So I know this can be very difficult because you're going in someone's mouth, but it needs to be done. Now you are taking care of people's bodily needs on many levels, and I'm sure you have to be creative. And how one person you can do one thing with, another person you have to create another method of approaching them. Well, the same thing with their oral care. This works for this person, this doesn't work for the other person. So, find out what works with that person and use that. Give the patient something to hold on to. So sometimes people, if you give them a stuffed animal or a towel or something when you're doing it, it makes them feel a little more comfortable. Okay, so we're coming to the end. Let's talk about what you need. Do not use a hammer. Unless you really don't like it. No, don't use a hammer. So toothbrushes. So these are regular toothbrushes, but what has been done here is that the handles have been modified. So very often as people get older, they get some arthritis in their hands and they can't grasp something. But these are sold in drugstores, or you can get them online. You put the handle through this and it makes it fatter, and it makes it so they can, they can also be done with eating utensils and stuff like that to help their grasp. And electric or power toothbrushes. I like them. Do any of you have automated toothbrushes? Yeah. So what's good about an automated toothbrush is that it goes back and forth or round and around. They're different types. And you place it in their mouth. Usually their mouth is kind of closed on it. And you just move it across the mouth. So instead of you doing that, it might be a little easier for them to have them just move it across their teeth, because it's rotating around, doing a good job. One thing you should know about automated toothbrushes is that you want to put the toothpaste on the toothbrush and don't start it. Wait till it goes in their mouth, because if you start it when it's out of their mouth, you're going to get covered with toothpaste. So put it on the toothbrush, put it in their mouth, and then kind of have them close their lips a little bit and then go around. So I think they're really excellent to use. And also, if they want to do it themselves, there's same kind of things that can help them hold it. There are even special toothbrushes that have two-sided toothbrushes. They get both sides at the same time, So that's something that, again, that you can find in drugstores or sold online. So you might, again, think, what would make this easier for this client? Maybe getting something like that. And tell, this is something you don't buy. Their children or caretakers would buy. Okay, so what do you see going on here?
Look like this
Healthy.
ship.
All right, what else? Go on.
Healthy with.
What do you see here?
Flat.
We've got a red, right? Yeah, right. So the reason I'm showing you this is that, when you brush your teeth, it gets all the surfaces of your teeth, except it can't get in between your teeth. And in my practice, I used to see this a lot, and probably if some of you are getting some bleeding gums when you brush your teeth, it's probably because you're not flossing or getting something in between your teeth. About 40% of the area around your teeth occurs right in between your teeth. So if you're not, again, it's like not taking a good shower. If you're not cleaning in between your teeth, you're missing that part of your surface. And that picture I showed you before about the gum against the tooth, it's going to be inflamed right there. In my practice, when I looked at x-rays and saw bone loss, most of the bone loss was in between the teeth. So what you need to do is you need to floss, and your clients need to floss or something like it. Now, it can be difficult to floss your teeth or your client's teeth. So there are floss holders you can buy, which makes it easier to get in and out of there, and you've seen them in the drugstore. And you should be flossing once a day. If you see bleeding when you're flossing, keep flossing, and in about a week or so, you won't see any bleeding anymore, because your body can heal up that quickly. Also, toothpicks, and these are called stimulants, but they're things you can buy. You need to get something between your teeth every day, and sometimes if people can't floss, they don't have the manual dexterity, they don't like doing it, sit there, watch television, and use a toothpick between your teeth. You could also use these special little brushes, and some of your clients might have some of these brushes, or you might have some of these brushes. And what's good about this is that, particularly when you have some gum recession, you can get that between there, and that's like, it's just like it's like brushing in between your teeth. So that's something that can work out well also. And you need to clean your tongue. You do, yeah. Why? Because your tongue is, as you see over here, it's full of this bacteria and plaque and stuff like that. And the way to clean it, there's special brushes you can use. What I do is I stick my tongue out, I hold my breath, and I brush it with my electric brush. When you first start doing it, you might gag a little bit, but it's kind of like you get used to it after a while, and then you won't gag. With your clients, they should be brushing their own tongue, or you can help them brush their tongue, and then there are all sorts of devices in the drugstore you can get to do that. Okay, denture adhesives, we talked about that. They're fine to use if the denture is basically fitting. Sometimes there's a powder that can be used. Now, sometimes your clients might have a special medicated toothpaste given to them by their dentist. And I used to do this quite frequently. People come in and this person has 8 cavities, So what you want them to do is to have an extra specially medicated fluoride to be putting on their teeth in the form of a paste. So this isn't regular toothpaste. Think of it as a medicine that's put on their teeth. And the reason I'm telling you this is that if they have this, you should read the instructions or ask someone, because they should not be swallowing this, because this could definitely cause stomach upset. So think of it just like any kind of medicine you give someone or procedure. There's a way to do it. With this, follow the directions. And also they might have something called this Peridex, which is not a regular mouthwash. This is a special, it's called chlorhexidine gluconate. It's a special chemical that they rinse with and then don't swallow. They spit it out. And there'll be instructions how often to use that. So you might see something like this too. I talked about dry mouth. So there are things you can get in the drugstore that make their oral lubricants. They make the mouth slippery. So what you can do as a care provider is, certainly if someone's complaining of dry mouth, have them sip some water frequently. Also, you can let their children know that there's something, you put a few drops on their tongue and they move it around, it makes their teeth slippery. This can be helpful if they have trouble swallowing pills. They can put a little bit on there and then take the pill. It makes it a little slippery. So there's things out there to make mouths more comfortable. Chewing sugarless gum is fine, actually, and that can stimulate salivary flow. So yeah, use sugarless gum for yourself or for your clients. Just finally, there's something dentists use on occasion. I get people in my practice who had a lot of cavities, and they're older, and maybe they had some dementia, and I couldn't do it all in one visit. So there's something we have that can stop cavities for a while until you can get them one at a time. It does turn the teeth kind of black, but these aren't cavities in this case. But you might, if someone comes back to the dentist and they had that, you might see that. But then the cavities could be done a little at a time when the patient can stand it. So we're finishing up now, important takeaways. So maintain regular checkups with the dentist. Understand the physical changes that occur as we age, and we talked about that. Communicate with the patient the importance of oral hygiene. We talked about that, and make it part of your daily care routine. Communicate with the family members and caretakers what you see and the status of the patient's health. This is very important, including oral health. So hopefully now, I've shown you some slides. You might know what's normal, what's not normal, and I'm encouraging you to be an active observer and caretaker of your patients. In terms of regular dental visits, what could be helpful is when the appointment is made. I know in my practice, if someone needed special care, maybe they were in a wheelchair or something, I had a special room that was able to accommodate wheelchair users. So you might want to, when the appointment is being made, if you see their children making the appointment, you might say, tell the dentist that they need this, or tell the dentist that Mrs. Jones needs some extra care because she has some dementia, because then we schedule more time. Instead of just making an appointment, you kind of make it for their needs. And again, you use your creativity and know what your clients need. So you are the healthcare providers on the front lines. You are the guys who are there, who see them most frequently. You are incredibly important to their daily health, and I have to say that you are underappreciated many times. But you're there for them, and that's why you're doing. Besides being a job, I think it's a service that people need, and thank you for doing that. And thank you for this.